I have been a registered nurse for over 25 years now, so my data may be a little old. A little bit about myself. I'm a first-generation immigrant from Hong Kong. I received my undergraduate and graduate training from Queen's University. So I graduated from Queen's twice. So you see in some of the pictures, that's Queen's University there. And I received my doctorate, my PhD from the University of Toronto. I worked in numerous hospitals and universities for my clinical work and research projects. Princess Margaret Cancer Center is one of them. So you can see UHN logo there, and then Kingston General Hospital. How many of you have been to Kingston or stopped by Kingston when you're going to Thousand Island? So Kingston General Hospital is one of the oldest hospitals that's still in use right now, and there are many pretty awesome buildings that were still from the original structure. My academic career spans mainly across 3 universities: University of Toronto, Toronto Metropolitan University, so formerly Ryerson, and who knows which school that is in the middle with some animal. Anybody have any ideas? I guess, what is that to begin with? Nobody wants to guess? That's an anteater. So I was at the University of California, Irvine at the very beginning of my professorship training, professorship journey. But anywho, so that's who I am, and I'm glad to be here. I have to admit, I sometimes do recycle my talk material. So when I was invited to do this, I had a surge of excitement because I am doing this talk from scratch with the help from Franco. I was told that these are some of the things to cover in the next 10 minutes. How did you get into this field? What is the minimum requirement? What is the prospect of this job, of this career, and what inspired you to go into this field? But really, my favorite questions over the years I've been a nurse and a professor are these ones. Can you go next? Oh, sorry, next slide, please. So you can go next. So I animated the slide. Nurses are so well paid. Why are they quitting? Why does it take so long to become a nurse if all you do is just to bathe patients and wash their bum and talk to them and hold their hand? Are you afraid of blood or touching dead people? Why are professors such horrible teachers? And then my favorite is actually, are you afraid of ghosts or have you seen spirits? So I'm going to ask you a question. How many of you actually came to want to know more about registered nurses or nursing professorship? So raise your hand if you want to hear more about nurses, nursing, RN. And okay, a few. Raise your hands if you wanted to hear about nursing professorship. I know some of you probably early on in your career, but okay. I made an executive decision before coming here. I was just guessing what people will be interested in. So I want to talk a little bit more about RNs and touching a little bit on nursing professorship because we only have 10 minutes, right? But regardless of whether we're focusing on RN or nursing professorship, we have to figure out what nursing is and what nurses do. Next slide, please. Our profession has come a long way from the time of Nightingale, which is the lady in the left, to who found modern nursing, to the Regulated Health Professional Act in 1991, which is the very small print screenshot there on the right-hand side. According to the Nursing Act 1991, the nursing profession scope of practice is defined by this statement in the middle. Taking a step back, scope of practice is a legal definition, or well, I'm not a legal professional, but in my view, is how our policy defines what we can do and what we're supposed to do, which translates to what you as consumer or as patient sees what nurses do on the bedside. So that's scope of practice. So there's a very long definition of scope of practice. If you care to read about it, please do. But if you do find it very dense, not to worry, because I really just want to talk a little bit about what nurses do, which I think most of you have some idea. So basically that definition translates to this. In the journey of life, of illness, or even in wellness, nurses are there. Some of the things that we do include assessing patients' health, administering medication. Sorry, next slide, please. I'm still getting used to, oh, yeah, perfect. I'm still getting used to dual computers. Sorry, I see something different on my screen and I have to tell the gentleman there to control it. So I was just going to say what nurses are doing. What are nurses' jobs? What are our tasks? It includes assessing patients' health, administering medications, monitoring and recording vital signs, communicating with other healthcare professionals to advocate for our patients, educating patients and families. So a lot of times when someone is discharged, we give them a little bit of very simple education to help them transition when they get home. And one thing we know the most is we provide emotional support to the patient, whether it's at the bedside, at the clinic, or at Emerge, wherever we see them. One of the things I always feel privileged as a nurse is to be able to touch people's lives. We do see people when they're vulnerable. We do get a lot of trust from patients. And if you think about it, these people that stepped into my hospital or my emergency room are complete strangers, but they trust me. You trust a nurse. So I find that a privilege. So nurses, I do teach my students to advocate for our patients because of this trust. In terms of employment opportunities, because this is a career fair, career workshop, our employment opportunity spans from your typical that most of us can imagine, hospitals, clinics, nursing home, to some of the not, sorry, can you take one step back? Perfect. So typical examples will be hospitals, clinics, nursing homes, to the not so common places like research and development. I have a lot of nurses that were my students, they switched to research during the pandemic because the bedside setting, the bedside environment is just so tough. Some of them switched to public health. There's telenursing, rehab, correctional services. I actually did a research project, investigating the work of correctional nurses. So nurses working in prisons, school nurse, summer camp, hence you see the marshmallow, and military. And then I also have heard nursing positions on cruise ships. So you do see nurses everywhere, and I do apologize. That Halloween is a little too early, but I like that graphic, so I include that there. Next slide, please. For those who want to hear a little bit about nursing professorship, many may see nursing professorship like the tip of an iceberg, a narrow subset of our profession. However, the role of a nursing professor can be multifaceted and significant. For example, I conduct research to understand, one of my projects, to understand resources that caregivers actually use when their loved one has cancer. And to improve quality of care, I use my finding to make suggestions. And these suggestions are published in academic journals, presented at conferences, and I'm also involved at professional associations. So you can see at the right, bottom right there. So that's the Canadian Association of Oncology Nursing. So I help to inform professional bodies to help nursing as a profession to set guidelines that will help us to do things differently. And also have been involved in, for example, writing exam questions for our licensing exam. So NCSBN is the licensing board. And I also have been involved in admissions for medical school and nursing school to make sure that we are able to adapt to the new generations and be able to select the most suitable candidates for our professions. And so even though nursing professorship, we seem to be in an ivory tower sometimes, but our career seems can be very dynamic. Job prospects. So PhD prepared nurses, also known as nursing scholars and nursing scientists, are highly educated professionals who have completed a PhD, Doctor of Philosophy. So not the same as medical school. So it's also called a doctor, but we study Doctor of Philosophy, PhD. And in more recent years, especially in the United States, there are also programs called DNP, Doctor of Nursing Practice. So these are all considered as a doctorate prepared nurse scientists. And nurse scientists or PhD prepared or doctorate prepared nurses are typically employed in a variety of settings where the advanced knowledge, research skills, expertise in nursing practice can be utilized. I'm not going to, in the interest of time, I'm not going to go through these, but if you're interested, I'm more than happy to talk after the presentation if you have specific questions about what exactly are those positions in these settings. Next slide. So let's shift. I'm going to switch gear a little bit to talk about classification. So there are two categories of nurses, RNs and RPNs. And so we all call nurses, and then there's also extended class, which is NPs. but by the College of Ontario, College of Nurses of Ontario. So these are the classes. So categories of nurses are the two big boxes, such as RN and RPN. And then under that, there are different sub-classifications or classes within the categories. I'm not going to talk about this this is not a lecture about legislation of nurses. So I'm just going to show this to let you know that most of what we will talk about and what you will be in touch with is the general class within our profession. And I think our next speaker is going to talk a little bit more about the extended class. Next slide, please. For those who are interested to become a nurse, whether it's RN or RPN, Franco has kindly helped me to do some searching, and he came up with this slide that talks about just one example of what are the application requirements to apply for an RN program, which is the left-hand side, and an RPN program, which is the right-hand side. These are pretty easily accessible information, to be honest. So if you're interested in nursing, my advice will be start looking at different schools that offer nursing programs and then look at the requirement. They're usually very similar. One of the programs that I haven't included here is actually the accelerated RN programs that are offered in certain universities in Ontario. For example, U of T has one. So those accelerated programs is not included here. I was thinking because most of you may be high school applicants. So those accelerated programs are for people who have at least 1 year of undergraduate degree, 1 year of undergraduate education under the belt. So that's why I didn't include here. But if you search Google accelerated nursing program in Ontario, you'll find a few. You can read through this. One thing that I would highlight is that even though it says 70% of average, at my school, it's always been over 90% of average to be able to get acceptance. I'm not the admission officer, but I was told that our admission has been very competitive, so something to keep in mind. Once you're accepted into a nursing program, what you see on the slide outlines the training, what it entails, and what does it, what is the requirement for you to finish the program and be eligible to apply for RN license in Ontario. And again, I haven't included the curriculum content for the accelerated nursing program. One of the questions that's asked a lot is how many hours of practicum do nurses do before they graduate? Anybody wants to take a guess? How many hours? Yeah, 500? Okay, close. Anybody else? Do you think it's more or less? It's more. So usually I've heard anywhere between 800. I've heard the most, like one of the programs I've heard is like 1,200. So it's 1,200 hours. So programs, nursing programs, they do go through accreditation. And I believe the minimum is around 750 for programs to be accredited, but that is something that's changing. And so for nursing professorship, typically we requires a PhD or equivalent degree in nursing or other health professionals. And then, so next slide, sorry. Okay, so this is the entrance requirement, the education requirement for nursing professorship. In order to, so it depends on the university that does the hiring, what's the position is for, but typically they will require a doctorate degree of some sort. So PhD, DNP, within nursing or another discipline. And they need to be licensed, usually within the jurisdiction of hiring. And some of them will require certification. So education certificate. For me, I have an oncology nursing certificate, so something like that. And they will be looking at teaching experience, clinical experience, and what is your research involvement, etc. So these are some of the entry level required for people who are interested in a career in nursing academia. Next slide. People often imagine that a dream job is well paid and that is easy. One of the leading job rankings in the US rates job based on a few criteria. 1, is it highly paid? 2, is it going to be highly paid in the future? 3, is it stressful? And 4, is the working environment unpleasant? I can reassure you that nursing is not a relaxing job. So how well are nurses compensated? Next slide, please. Rumor has it that nurses make a lot. How much do you think we make as new grads? The answer is it depends. I listed on the slides some of the factors for consideration. And for those of you who are not into Asian cultures, the cat at the background is what we call 招財貓. It's a cat that brings money. So that's why I use that background. So here's some factors for consideration that I just put down there. I will just point out a few highlights. So in order to calculate how much we make, bottom line is we pay by the hour, most of us. And our RN that's working 40 hours a week is going to work about 2,080 hours per year. And if the RN works 36 hours a week, that's about 1,872 hours a year. So the wage usually is regulated by union, and most of the acute care and long-term care jobs in Ontario are unionized. So therefore, I included two screenshots to the right-hand side of the slide that talks about the Ontario Nursing Association, ONA. So some of you may have heard that. That is the union for most nurses in Ontario. So if you're interested, you can Google ONA salary scale, then you don't have to ask me, saves you some work. And there's a scale based on seniority. And then it depends on overtime, stat pay, night shifts, etc. So there are like variations depending on how much overtime you take. I've heard one of my colleagues that does a lot of overtime that makes a lot of money. And then there's also agency nurses that is totally at a different pay scale. I'm sure you've heard that on the news. But anyway, if you do the math, a new grad usually makes about 70K per year, plus or minus weekend stuff, weekend premium, nights premium. And then after 8 years, right now, we're looking at over 100K. So in the interest of time, I'm not going to talk about the salary of professorship or professors, but if you're interested, we can talk a little bit more about it. But it's less regulated because most of our jobs are not unionized across the province. Next slide. Because nursing shortage is making news again, I feel strongly to touch on what it means to stay on the job. I know you probably don't even think about that. It's like, how do I get in, right? Or should I get in? But I should talk a little bit about what does it mean for us to stay in the job, and how do we? I have colleagues that I went to nursing school with, and they are still on the front line. So how do they do that? But to begin with, I have to say we all have different financial goals and priorities, and finding a career that aligns with our values, interests, and lifestyle choices can help us achieve a sense of fulfillment in all areas of our lives. And so a lot of nurses, because of our jobs, what we do becomes part of our identity. So it's not just that once we take off our uniform, it's done. We think about it, it stays with us, and that's why we have burnouts, right? And I highlighted some of the issues that will happen to most nurses once they are licensed, once they're working. Continue education. Sorry, parents, education doesn't end there. So once we start the job, likely, especially now, a lot of my ex-students will want to go back to school after a year or two for their masters, for their NPs, whatnot. So not just about on-the-job continue education. So there's a lot of continuing schooling as well. And then the second point and third point there is just talking a little bit about work environment. So I'm pretty sure you may have heard that during the pandemic, a lot of nurses have to work extra overtime. And I have some friends that couldn't take vacation for a year. So these are the kind of things that really affect our lifestyle and affecting our decisions to stay on the job. And a lot of nurses, they don't stay on the job, but they may switch to another, they stay in a career, but they don't stay in the same job. So I'm happy to talk about that if you have questions after. I know our time is coming to an end, so just a few thoughts to close my presentation. We all want to find a dream job that's enjoyable and meaningful, but what does that actually mean? Some people imagine that the answer involves discovering their passion through a flash of insight, while others think the key elements of their dream job are that it has to be easy and highly paid. While it's important to think about all that and to follow your passion, if you know your passion, that's great. When I was a high school kid, I didn't know what my passion was. I think that one can develop passion by doing work you find enjoyable and meaningful. And the key is to get good at something that helps others, regardless of what you choose. So I think if you chose to come to this career forum for healthcare profession, I think you're the right place, because regardless of which profession you choose, it's for good means, right? And with that, I wish you all the best on this journey, and I would take any questions that you may have.
Sure. Supposedly we have a speaker to talk about the nurse practitioner.
And then we'll take questions.
She can also she was sick. So,
Oh no. Okay.
Can you elaborate a little bit about what's that profession?
So yeah, I guess I can talk a little bit about what NP does. So nurse practitioner, to talk about from a legislation perspective, and NP does a little bit, they have more authority with patient populations. So they're allowed to prescribe, they're allowed to perform some procedures that registered nurses cannot. And in many healthcare clinics, so primary care clinic, like family doctors practice, nurse practitioners actually are working under the supervision of a GP to perform normal assessment, healthy, uneventful follow-up, or newborn assessment. So they are able to deal with most of the uncomplicated situations. However, they do need extra training to be able to have the autonomy to decide when to do what procedure and to make prescription. So the education requirement for NP requires an additional diploma, and most of the programs in Ontario that I know of, they do combine the NP certificate with a master's degree. And it's highly competitive. From what I know, they look at your undergraduate nursing degree average plus about 2 years of practice experience. So I do have a lot of nurses that I taught in undergrad. And when the 2 years mark is up, they'll email me and go, can I get a reference from you to apply for NP program? So that's how I know usually people work for a year or two before they apply for the nurse practitioner program. Job prospect is great. The history of NP actually started in the 80s. But then there were not a lot of employment opportunities in Ontario, so they died down a little bit. But since the early 2000s, NP designation actually has come back to life again. And I foresee the job prospect to be quite good, particularly in light of our primary care shortage. But I didn't prepare for this, so I do apologize. Does anybody have any specific questions about NPs?
I think NP is a 2-year course.
Oh, the program generally 2 years. So the
I think they have for many universities in Ontario.
Yeah, so they're quite university. So most nursing departments are under the pressure to develop their own NP programs. TMU has one. Our TMU NP program is primary care, and so you have to look at the different stream. And it's usually 2 years. Some compress it to 18 months, but I would think they're pretty equivalent across. And what I do know, I have colleagues that teach in the NP programs. I don't teach in the NP programs because I don't have an NP destination. But what I know is the NP programs across Ontario, they do share a lot of resources. So the education preparation is fairly similar. Yeah. Good questions. Yeah. Any questions for new grad? Yes.
The question is, if you need 90% average to become to get into nursing school, what happens to have a medical school? So the answer is because medical school requires second degree. So medical school entry application generally happens after year 3 of undergrad. So if your high school average is 90%, there's no guarantee that your undergrad average will stay that way. In fact, in my experience teaching in undergrad, I've taught undergrad programming for 20 years now. Most people, you may have heard, experience a drop in average. So you can be a 90% high school student, but your grade will drop when you start your undergrad. Just as a note, if you apply for nursing school, please do not tell them your dream is to become a doctor. Do not do that. That is big no. So don't tell other people. Yes.
As an admissions officer for medical school, what do you look for in students?
So the question is, as an admission officer for medical school, what do we look for? I'm on an admission committee, so I don't look at the applications yet. So right now we're just setting up the metrics. Like, so what are the criteria for accepting students or not? So as a part of the committee, we actually look for the evidence. as to what are the best things. So you probably have heard in order to get into medicine, you have to write MCAT, you have to do all these scary things, and you have to do really, really well. So as a member of the committee, we actually look at the evidence for those and where is the cutoff set. So that would be a short answer to the question. Yeah. So I see a lot of people interested in medicine. Oh, it's a good thing. I think it's a very great profession. I know there's a lot of people may hurt tension between medicine and nursing, but I don't see it that way. I think it's all good. Takes a special person to do each job, right?
But I think it's different profession.
Yeah, we work together. Yeah.
I think doctors may not attending the patient as the nurses did, right?
Yeah.
Nurses take care of the well-being. A lot of it.
To be a nurse, you really are there with the patient. Franco can tell you, like he started working a few months ago, and you really are there for the patients. The doctors come in, they do whatever they need to do, they rip open the dressing, they leave. The nurse take care of the patient and making sure the patient is fine, right? So I think it's different. Overlap, lots of overlap. Any questions for Franco about his nursing school experience, his new grad experience, transitioning, the scary nights that he had? I'm so proud of you. You've done so well. He's done so well. He really is our star.
Nurses also need to do like a long shift as well.
Nursing shifts. So at hospital, usually it's 8 or 12-hour shifts. I would think most of the shifts are still 12 hours if you're inpatient unit. And most new grads do choose to work in hospitals. I do have some students that says, I will never want to set foot in a hospital ever again. So you'll find out those preferences when you're in the program. And do not be afraid to pursue whatever tickles your fancy. I think there are a lot of opportunities for nursing. It's a tough profession, but you'll find a lot of satisfaction in it. Yes.
Nursing usually have like heavy duty or stuff moving before. How does that mean nowadays?
So the question is, there may be some occupational hazards like heavy lifting, dealing with body fluids, blood, dealing with needles. Franco, do you have any good answers to it? We get trained to do it to begin with. And what was your experience like?
I think it's mainly from the training that we get from the.
Thank you.
I think it's mainly the training that we get from the schools to ensure that we safely transfer and protect ourselves as well as the patients. So prior to working with patients, we get trained first from the hospitals themselves as well as the school programs to ensure safety, patient safety, as well as our own safety.
And we do get, thank you so much. My arm is not that long. So we do get occupational, health to assess us. Like, so there's a lot of safety checks in place. I will be very honest though, a lot of my colleagues that I went to nursing school with, they do have back injuries, especially if you stay on the front line for long. So we always say, watch your posture, get help if you need to. And yeah, get massage if you need to. Yeah, so that's lots of that to keep the longevity of a career. But that's a very good question. Yeah. And you can switch to clinics too. Like I do have friends that switch to clinics at later, like, after 20, 30 years of bedside nursing, they will switch to clinics. And with the nursing shortage, I can tell you that the non-inpatient positions are opening up much more readily for nurses that are not very experienced. Gone were the days that you need 20, 30 years of seniority to get the clinic jobs. But now, I'm sure Dr. Chow knows, cardiac clinics, even I was at a conference in BC, and then BC Cancer Agency was asking me, do you know any new grads that want to work in our clinic? And I'm like, you never hire new grads. What are you talking about? So much more opportunities. My concern is mentorship, actually. My mentorship is very important for nurses. Thank you. Yeah, thank you.
Can I make a comment?
Yeah.
So once again, I want to say, there's the number of nursing job out there is tremendous. I mean, every single meeting in administration meeting on Wednesday morning that I'm in, for cardiology, for example, we talk about recruitment of nurses, not so much doctors. But recruitment of nurses is huge. And every time we talk about, how, many of the nurses have retired and, especially the senior ones, which is very concerning because they are the one who pass on the knowledge to the younger ones. So we do need a lot of them. And the nursing profession from many traditional way of looking at it, it's just like, caring for patients and the bedside, but it's not true. We have lots of nurse educators. I've got lots of nurse practitioners who do additional training and specialize in different areas. So we have in our cardiology department, we have at least 6 or 7 nurse practitioner helps in all different aspects. Someone specializing like pacemaker, someone specializing in structural heart valve disease that we are doing in a very advanced fashion in the province. So each of them specialize in something, and we think we treat them almost as equal. One of my colleagues is actually a nurse practitioner in heart failure. And I always because I don't do as much as he does, then I would just go and ask him, what should I do? So we actually get consulted. So we value nurse as doctors. I mean, the correct way these days is actually we value nurses as almost equal in my mind, if not higher sometimes. And then the other thing is about injuries. So bedside care, yes, there's a possibility of injury, but you are trained. So you have to learn how to actually move patient properly. But there's also nursing assistant now. There's also other colleagues who help in, and also devices that help with patients who are really heavy, because obesity is a major problem. So things like that. So in fact, nursing profession is very wide these days. I work with lots of a number of nursing professors who do research. So we do advanced technology research, AI, and all this type of things. So it's a huge field. It's not like what you conceived before.
Dr. Chow, I do let my students use AI. I think it's foolish to say you can't use ChatGPT. I think it's how we teach. We have to teach differently. But yes, so there's a lot of horizontal movements for nursing. I totally agree. I think the time is almost up unless there are other questions. I hope this is helpful. If anybody had any other questions, you have my email. I'm happy to talk more. And thank you for coming. I think I'm very happy to see that there are so many of you may be interested in my profession. So thank you.